Have you ever wondered what tinnitus is or where it comes from? My name's Dr Edmund Farrar. I'm an ex-military doctor and I have tinnitus myself. Today we're going to learn all about what is tinnitus, where does it come from, and how can we tune it out. So what is tinnitus? Well, an analogy I often like to use is that of a radio. So think of an analog radio. It's tuned into the station, and if you turn the little knob, you'll hear this sound. So the radio's not picking up any signal, but it's still making a sound. And that's what's happening in your brain. There is no signal being received from the nerves through the ears, but your brain is still producing a sound. Tinnitus is a lot more common than you might think. Worldwide, it's estimated that around 1 in 7 people will have what we call chronic tinnitus. Chronic tinnitus means tinnitus that doesn't go away. However, if we want to narrow that down to a number of people that don't just have tinnitus, but struggle with it, it's around 1 in 20 people. So if you were to take a group of 100 people, around 5 of them would be struggling with tinnitus. So it's a lot more common than you think. For many people, tinnitus is a life-changing event. It can have a huge impact on a number of different areas of our life, such as our mood, our sleep, our focus, our relationships, our hearing, and a number of other areas. How tinnitus impacts us will vary quite a lot person to person. For some people, it will have a big impact. It could have a big impact on sleep. For others, it could have a big impact on their focus. Others, it could be both. What's consistent is that really severe tinnitus or intrusive tinnitus will have an impact on the quality of your life. And for many people, they will refer to it as the life they had before their tinnitus and the life they had after tinnitus. You've probably been told by your doctor, "I'm sorry, there's nothing I can do to help." But that's not true. There are so many different ways that we can help tinnitus, and there is proven treatments that have shown to be effective. The way that tinnitus can affect us, or the way that tinnitus can be treated, very much depends on the cause. In many cases, there are reversible causes of tinnitus. In many cases, there are irreversible causes of tinnitus. You may not even know what caused your tinnitus, and that's okay, because there are many times when we don't get to find out what the answer is. Many of you will have had an MRI scan, which is one of the most high resolution scans you can do of the brain, and nothing will have been found. And that's normal. It's normal to not know what's causing the tinnitus. And although that's very frustrating, it doesn't mean that there's nothing that we can do, and it doesn't mean that we can't help. So sometimes when we do find a cause, the important thing to remember here is that the tinnitus isn't a disease in itself, but it's the symptom of an underlying cause. So I mentioned this cause could be reversible or irreversible. Reversible causes of tinnitus could be something like earwax, or an ear infection, or a high level of noise exposure in a short period of time. Those things can cause temporary tinnitus. Tinnitus can also be permanent, and again, similar things can cause those. So an ear infection or noise exposure could cause permanent tinnitus, but it can also be caused by things like repeated noise exposure over a long period of time, or as we age, our hearing deteriorates, and that can cause tinnitus as well. So if you know what the cause of your tinnitus is, or they haven't been able to find out what the cause is, that's okay. The key to managing tinnitus is first understanding the impact that it has on our bodies and our brains. So I'm going to pass you over to Anna, who is Otto's therapy lead, to tell you more.
So research suggests that tinnitus is definitely on the rise. It's becoming more common. Some of that is about the general noise that we're exposed to. Our lives are becoming noisier. We're exposed to more traffic, more sort of environmental noise. Workplace noise in most Western European countries and in some places in America and Canada have regulations to protect workers from noise. But obviously, you know, there will always be military exposure, so lots of loud gunfire. There's a lot more recreational noise around, people shooting, people going to gigs again after COVID and exposing themselves to loud noise again. And also the fact that we do a lot more video games. So we have headphones on all the time, or iPods, sorry, not iPads, that shows my age, iPods in our ears. And so we're exposed to more sound all the time. Whereas before we may have had periods when we weren't very closely listening or hearing noise. Nowadays, people will have their iPods on all the time. See, I said it again. No, I said iPods. iPods were right. People will have their headphones or their iPods in almost all the day. And so they're constantly bombarded to sound actually close inside the head. And whilst you can reduce the sound level, and also that there is a limit to the volume, the intensity of the sound, most headphones and any ear-based loudspeakers will have a standard on them, an international standard. So they're not going to produce sound that's going to be harmful. However, sound is accumulative. So the more sound you're exposed to over long periods of time, the more the risk of damage to your tiny little nerves of hearing can be. The tiny little hair cells in the inside of the ear can be damaged by noise. And once they're damaged, if they're damaged once, they can recover and spring back, and we get what we call temporary threshold shift, and that recovers. Most of us will have experienced that when we go to a concert or we go to the cinema. Our hearing's not quite as good when we come out, and it gradually gets better. But if you keep doing that, if you keep putting yourself in those situations, the nerve endings don't recover, and we have noise-induced hearing loss, which is the major cause for hearing loss in the Western world. We need to protect our hearing because there is a link with noise-induced hearing loss and hearing loss in general and tinnitus. 8 out of 10 people with tinnitus will have a hearing loss associated with that. Now, that might be a very mild hearing loss, it might be a very severe hearing loss, but there will be a level of hearing loss or hearing impairment, particularly in the high frequencies, in the consonant sounds. So we need to protect our hearing. And there are ways to do that. You can limit the amount of time you're exposed to sound. You can make sure that you have periods of time when you're not exposed to lots and lots of sound. And you can also use that technology in more positive ways. So you can stream through your phone, allowing yourself to have directional hearing rather than turning everything up really loudly. There are devices that you can stream the TV into your hearing aids so that you don't have to have the telly really, really loudly. And so there's lots of things that you can do about that. But one of the things that we need to be aware of is that there are more people with tinnitus around, and we need to recognise that there is a higher risk because of general noise exposure. Research has shown that the noise exposure in general is the biggest single preventable cause of tinnitus. And so if we can reduce noise exposure, we can reduce the risk of tinnitus. And a recent research suggests that 35% of people with tinnitus had tinnitus as a direct consequence of having noise exposure. So it's certainly something that we need to protect ourselves about. Of course, lots of people don't know what caused their tinnitus, and whilst it's important for many of us to know what caused our tinnitus, the reality is that for some people we'll never know. The important part of that is knowing that you can understand the impact that tinnitus has and the emotional response that we have to tinnitus, and we can certainly work on controlling that, and that's what CBT does. It gives us the tools to control and recognise our emotional response and learn new ways to redirect and refocus our attention away from tinnitus. I like to always explain to people it's a bit like when you're driving along in a car and you can hear the sound of the road and the other cars going past. But after a little while, you're probably not even noticing that noise, but you're still carrying on driving, you're still paying attention, but the noise disappears. Or if you live by the side of a train line, when you first move in, the trains are really, really loud, but after a little while, they become just part of your everyday noise that's around you and you don't notice it. And with CBT, you can learn techniques which will help you change the way that you think and change the way that you focus, so that tinnitus is just one of the noises around you. I certainly find that my tinnitus, which is normally quite loud and can be not a very pleasant sound, it's a very harsh sound, that, you know, I don't pay attention to it, I don't notice it. So it becomes just part of the sound that's around me, my acoustic ecology, as it's appropriately called. And so CBT gives us the tools to deal better and get on with our life and tune out from tinnitus.
So now you know all about what is tinnitus, what causes it, how you can prevent it from getting worse, and that there are ways that you can manage it and tune it out. So if you learned something new today, please subscribe. We'll be releasing a lot more of these videos, so if there's something else you want to learn about tinnitus or how it's managed and treated, please do let us know in the comments. See you next time.